day and welcome to today's Dr. Anyoha's podcast. Today's podcast is going to be mostly about what I do for babies when they come to my office as newborns. Newborns are babies who just a few days old. By the time I see them in my pediatric office, they are about 3 days, 5 days old. I'm excited each time I see new babies, newborns, especially in my office. This podcast is for everybody, the PA students, the medical students, the moms, dads, people who are interested in newborns and babies, and people who are expecting babies, their newborns. I'm talking about the first time babies come to a pediatric office after being discharged from the hospital. When a mom gives birth to a baby, they usually spend about 2 days in the hospital, 2 days, 3 days in the hospital, depending on whether they had a normal delivery or cesarean sections. Those who have cesarean section tend to stay longer. When the babies are born and stay 2 days in the hospital, 3 days in the hospital, and their parents bring them home, they're discharged from the hospital and they bring them home, they're supposed to see the pediatrician as part of checking the baby to make sure the baby is okay, the baby is developing well, that there's nothing wrong with the baby, that the baby is doing okay. The first newborn visit. And the doctors who discharge the babies, the nurses who discharge the babies from the nursery or maternal baby unit, emphasize to take these babies to their pediatricians. Let us imagine that we're seeing a baby who is 5 days old. What do we do? What do I do? This is the podcast of today to give you insight on what I do. So the first thing I do is to, of course, welcome the new parents. Sometimes the parents have had babies before, so they're used to babies. Sometimes these babies are the first babies of the parents, so they're different expectation, different experience. Parents come with different experiences. But no matter what experience a parent comes with, I usually start by congratulating the parents, the mother, for a job well done. And what I do is ask them about their pregnancy experience, their labor and delivery experience, and of course trying to find out if everything went on okay, and the days the baby spent in the hospital, if there's anything of concern, or if everything went on okay. So I explored that 2 days, 3 days baby stayed in the hospital, and inquire about the shots the baby got, how much the baby weighed, and if the parents remember the length of the baby when the baby is born, the weight of the baby, like I said, and of course, if they remember the head circumference of the baby when the baby is born. So these are the things that nurses and doctors check when the baby is born. After the baby is stable and breathing very well and suction very well and dry very well, we want to know about the birth weight, the height, the length of the baby, and the head circumference. Sometimes the nurses measure the chest circumference of the baby. So I want to determine how much the parents know and inquire if they were aware that the baby had vitamin K shot when the baby was born, and if they were aware that the baby had erythromycin ointment. These two events usually happen in labor and delivery. And of course, I want to determine if they're aware that the baby had hepatitis B vaccine, which most babies have after they are born. This is kind of a small quiz, questions and ways to interact with the parents, with the mother and the father and the siblings. So we do this interaction exchange, what the parents know, what they remember. Sometimes they do remember a lot. Sometimes parents are vary a lot and know what's going on. I juggle their memory. I want to find out what they know. Next thing I do is I want to find out if the baby had any problems. Was the baby jaundiced while the baby was in the hospital? If the baby was jaundiced or yellow, was there any intervention? Like, was there any light or phototherapy and so on and so forth? Usually none. My next question would be what the parents experienced so far, because they're being home with the baby, taking care of this baby for 2 or 3 days. I want to know their experiences so far. What do they feel about the baby? How are they managing? Who's helping? Especially if the mom comes along or if the dad comes along. I want to see what other help they have. And of course, if it's a young mom, if it's a first-time mom, I want to inquire about the help, who's helping, who's teaching the parent or the mom how to navigate some of these baby's issues, because sometimes it's difficult to navigate and take care of a baby, do all the things that the baby needs, and then get some sleep and do all the routine things moms do. Inquiring about who's helping is very important to me. This is about general conversation before I even start doing my own measurement and examination. I want to determine moms and dads' comfort about this baby. I inquire about their concerns. Have they noticed any concerns since they've been with this baby for 2-3 days? What is the experience? The baby brings joy? Yes. What about the other siblings? How do they relate to this baby? And I hear a lot of positive things. The siblings are always excited to see a new baby. These are the background information I elicit from the parents on their first visit with the newborn. And of course, I inquire about feeding. One of the most important things, whether the mother is breastfeeding solely or doing formula solely, or combining breast milk with formula. I'm interested in that because moms who are solely breastfeeding, their babies have to be on vitamin D. A supplement. We'll talk about that, and if the only baby is taking his breast milk, then I have to prescribe vitamin D for the baby to continue until mother introduces solid foods or cereal. We'll talk about that method of feeding. Talk about mostly babies eat, they feed, they poop, they sleep. That is the pattern of a newborn baby. They feed, they sleep, and they poop. Each time they wake up, they want to feed. And once they feed, they poop, they sleep. And the parents recognize that pattern, quickly. And usually some babies do this every 2 hours, others every 3 hours. Ask about whether the baby sleeps through the night. A newborn baby is not supposed to sleep through the night. Some babies do forget to wake up and feed. So I tell them after 3 hours, especially during the night, your baby's not waking up. Just wake him up, wake her up, and feed her. These are general discussions before I pick up the baby or ask the parents to put the baby on the exam table or on the weighing scale to be weighed. When I weigh the baby, if the diaper is weight, they change the diaper before I weigh the baby. If the parents have just changed the diaper before they came in, there's no point taking the diaper away because it doesn't contribute much to the weight. Usually babies, when they're born, the average weight of a baby is about 7 pounds, 11 ounces, which is about 3 kilograms, 3.5 kilograms. Most babies will weigh that around 7 pounds, but it's always a range. 5 pounds to 9 pounds is always a range. There are babies who are 10 pounds, big babies, we call them large for gestational age babies. They're big, they're huge babies. Sometimes because their mothers have gestational diabetes and these babies are very big. They're very big because their mother's sugar is going into the baby through the cord and placenta and making the baby big. But once the baby is born, the sugar in the baby goes down quickly. So babies who are very big, more than 10 pounds or 9 pounds, or if their mother had gestational diabetes, these babies are prone to low sugar at birth. We call hypoglycemia, low sugar. We're always looking at that, something to watch. To go back, usually babies' weight is about 5 pounds to 9 pounds, something like that. And their length, the average length of a baby is about 18 inches. 18 inches, 19 inches. That is the average length of a baby. Sometimes babies are 20 inches, 21 inches if their parents are tall. The head circumference is always something to measure as well. So these are the 3 things I do when the babies come in. I remeasure their weight and compare it to their birth weight. So I measure that. I remeasure their length to compare with the birth length. Usually the same because the baby shouldn't have grown much within a couple of days, within a week. And of course, I remeasure their head circumference. The circumference of the head is very important because that's where the brain is. You want the head to be growing as well and to be on the normal range. But it doesn't matter whether your baby is 18 inches or 19 inches or 20 inches in length, or whether they're 5 pounds, 6 pounds, 7 pounds, 8 pounds, 10 pounds. It doesn't really matter. What matters is the baby's performance over time, how their weight is stabilizing or increasing over time within weeks. I tell parents, usually babies lose a little bit of weight after birth. In other words, if your baby weighed 7 pounds at birth and you've been home with this baby for 2 days, and when you bring the baby to the doctors, to my office, the 7 pounds might go to 6 pounds, 1 ounce, 6 pounds, 5 ounces, 5 ounces, or a little bit less than 7 pounds. So we expect babies to lose a little bit of weight after birth. So I don't want parents to be panicking about fluctuation of weight in ounces. If it's too much weight loss, then we can advise parents on increasing the feed or feeding more frequently. Measurement of these 3 parameters are what we do as pediatricians when a baby comes. And of course, the general examination of a baby, how the baby feels, looking at the baby, assessing the baby's movement. Babies are vigorous and they're very strong. I usually like to pick the babies up and feel how strong they are, both horizontally and vertically. I will hold the babies. Because I'm an expert, I've been dealing with babies since I became a pediatrician since 1996. If you count residencies from 1993, so I know I'm an expert on babies. So I can pick these babies up, hold them, make sure they have good strength. Good strength means the baby is active, alert, and strong. You want a baby to be strong and really strong. You don't want a baby who's floppy. A baby who's floppy, who flops, who's weak is something to be concerned. Babies go after your fingers if you put it at the corner of his or her mouth. This is called rooting reflex. And of course, the sucking reflex is there. Babies, if you put your fingers in their palm, they're supposed to grasp it. Grasp reflex. So the babies are very responsive. They're responsive to what is going on. So I like to elicit some of these things and show it to some of the students who follow me as I examine the babies. Then I'll check out the baby's breathing, check out the baby's hips, make sure the hips are flexible and rotating normally without clicks or clunks. Then I'll do more rush reflex, what we call startle reflex, to make sure the baby is responding. These are the things that make me feel comfortable telling the parents or the mother that this baby is doing okay, is doing fine. The baby is developing well. The baby has done well so far at age 5 days, 3 days, depending on when they brought the baby to come and see me, the first visit. If it is a male baby, you want to look at a circumcision if the baby was circumcised. We look at the circumcision, make sure it's healing very well, and make sure the parents are putting enough Vaseline to lubricate the wound until it heals very well. Another place to take a look at is the umbilicus, the belly button area. See if it's healing well. Healing well means it's dry. At this point, the umbilical cord should be dry. No oozing or no foul smelling. Parents should be concerned about the baby's umbilical cord, especially if you are in the so-called resource-strapped countries somewhere in the world, so-called resource poor country. We should be paying attention to a few babies' umbilical cord. Make sure it's not smelling, make sure it's clean, and because that could be a source of infections. Umbilical cord and belly button is area we look at very closely. And sometimes babies develop what we call granulation tissues, like inflammation that some babies' belly button develops as it heals. Sometimes we have to cauterize those. I have a silver nitrate sticks which I use to cauterize those, and it's very easy to do that with a silver nitrate stick. You can cauterize. It stings a little bit, but babies do well with that. After examining this baby and determining that the baby is doing very well, the baby is strong, responding, and doing all the things the baby should do, I will tell that to the parents. I will tell them what my findings are. And usually I want to congratulate the parents for doing a good job, for bringing the baby. So far, they're doing very good. I encourage them to feed babies. I usually like parents to feed the babies on demand. If a baby is hungry, you feed him. Babies eat at different rate, different hours. Some babies eat every 2 hours, others every 3 hours, but a baby who's hungry has to be fed. There's no need of putting a pacifier in your baby's mouth if the baby's hungry. Of course, you have to check the diet and make sure the baby is not soiled or there's nothing hurting the baby. Most times when babies are crying, it's because they're hungry. They have to eat. As a matter of fact, I will postpone my examination until the baby stops crying. So I tell parents, feed your baby. If you're breastfeeding, we'll give you 15-20 minutes to feed the baby, and then we continue the examination. If you have a bottle, you feed your baby and the baby stops crying, there's no point trying to examine a baby who's crying, who's hungry. You're not going to get anywhere. So when I've finished, I'll hand over the baby to the parents. And then we'll talk about how to communicate with the babies, how to engage the babies. I'd share several ways parents can engage the baby by talking to them. You might think the baby is not listening. They are. Holding them, swaddling them, holding them, hugging them. Babies need a lot of skin-to-skin contact. The more you hold your baby, the more the baby feels soothed, the more the baby is well regulated and less cranky. So holding, hugging, swaddling is very, very important. In fact, I demonstrate that when I have a baby on the examination table and the baby start crying. What do? I just put my fingers on the baby's palm and the baby grasps my fingers and stop crying. And the students and the parents wonder whether I am a magician. I am a baby magician because I've been doing this for a long time that I know how to easily regulate babies and soothe babies as a doctor. I teach parents about holding the baby, staying close to your baby, talking to them, trying to engage them in mutual eye gaze, looking at their face, singing lullabies, and of course doing all the little things that parents and babies do. Because these are the foundation of development. These are the foundations of brain development, language acquisition, the ability for a baby to start talking, the ability of baby to start speaking, using their words, emanate from all these little things. Okay, the little things we do, the little things babies do, the little things parents do for the babies. Okay, changing them, staying close to them, babies hearing your voice, hugging and kissing and feeding them, taking care of them. And some babies are very sensitive, so you might have to dim the light and console your baby. A baby who is well consoled is a baby who is ready to learn. These are the things I discuss with the parents on their first visit. There's no shots on the first visit if the baby got his or her hepatitis B on the first day for leaving the hospital. There's no shots until the baby is about 2 months. The conclusion will be to bring the baby at age 1 month. When the baby comes at 1 month of age, it's the same routine I do. Talking to the parents about their experience so far with the newborn. They've had 30 days to stay with this baby and to know more about the babies and to learn more about the babies. And the babies are learning. This is a two-way thing. You're learning from a baby, the baby's learning from you. There should be a chemistry, what they call a dance. It should be choreography, dance. You should understand your baby, the baby should understand you. And I think within a month, a baby would have understood their caregivers, should understand their mom, their dad, the routine, and the mother or father should understand this baby. So there's mutual understanding, unfolding relationship. And the better the relationship is, the better the baby's social and emotional well-being as the baby grows up. And this good social, emotional well-being is the things that will translate to learning words and language acquisition. And of course, being smart. There's no magic about this. This is all rooted in the little things parents do with their babies. Thank you so much for listening. This conversation is for everybody, for grandfathers, for kindergarten teachers, for anybody who is dealing with a baby. This is coming from a pediatrician who's been doing this for almost 30 years, a PhD in infant and early childhood development. I went to a graduate school just to learn about this socio-emotional well-being of infants and children. I know this is all packed up, but it's important I share this information. Thank you so much, and please share with your friends and families. Thank you.